Hello, I'm Dr. Bridget Nash, and I'd like to welcome you to The Therapy Show, a podcast series that seeks to demystify mental health treatment. Today, I'm honored to welcome Dr. Elizabeth Nielson, who is a psychologist and co-founder of Fluence, an organization that provides continuing education and training programs for therapists who wish to engage in the integration of psychedelic experiences in a clinical setting. Dr. Nielson is the Site Co-Principal Investigator and clinician on a MAPS-3 clinical trial studying MDMA-assisted psychotherapy for post-traumatic stress disorder, and has also served as a therapist on FDA-approved clinical trials of Psilocybin-Assisted treatment of alcohol use disorder, which is the topic we will discuss today. Dr. Nielson, welcome to The Therapy Show.
Thank you.
Can you start by telling us a little bit about your personal background and professional development that led to your research into the use of psilocybin to treat substance use disorder?
Sure. I think this is a really good place to start because it might come as a little bit of a surprise, but I actually got interested in becoming a mental health care researcher through witnessing some of the shortcomings of the mental health care system very early on in my life. And so although I recognized the immense potential of psychotherapy, and I saw that psychotherapy had really immense potential when it was provided in a respectful and supportive way, I could also see that there was a lot of need for improvement in the general way that mental suffering, especially the kind that results in substance use problems, was conceptualized and treated and just sort of thought of in our society. So I began to study psychology as an undergraduate student, but it wasn't really until I got to my master's degree program. I was a little bit older and I had a little bit more sense of grounding in what kinds of careers and work choices I might be making with my future at that point that I started at the New School for Social Research in New York City. And that's really where I was exposed to new paradigms and ideas like harm reduction. I studied Buddhist psychology there, and that started to help me think about what a different approach would look like. And I was aware of the history of psychedelics as potential aids to psychotherapy and in mental health treatment, but I wasn't trying to become a psychedelic therapist or researcher at that time because if you keep in mind, this was really in the late 90s, early 2000s, and it was really full-on drug war time. There wasn't a hint of serious discussion about psychedelic research or even a mainstream conversation about medical cannabis at the time. So it wasn't on my radar as something that I was seeking as a career, but I was really interested in how I could improve research and ways of working with people who were suffering with mental health in general.
When and how did you realize that psychedelics, in particular psilocybin-assisted psychotherapy, would be an effective treatment for substance use disorder?
So I think it's really important to understand how we conceptualize these kinds of problems. So I was very interested in the social implications and the effects of stigma and drug policy and the labeling and identification of people who struggle in this way. From a really early on in my studies, I was really interested in the idea that there exists a category of people who are qualitatively distinct in some fundamental and permanent way. People that are most often in substance use treatment settings or mental health treatment settings labeled as having a substance use disorder or an addiction. I was really curious about that idea. It didn't totally fit with my experience of the world and what I was observing in people around me. And I always just found it problematic. And in light of that, I really studied a variety of different approaches to working with people who were using substances over the years, as well as a variety of ways that just drug use was conceptualized in our society, and questions like, why do we see some types of substance use as problematic and others not, or problematic for some people and for others not? Where do we localize those problems, right? So I was really interested in approaches such as harm reduction, mindfulness-based approaches, and approaches that seem to value and foster a new relationship with the person's actual experience and relationship to their substance use. That was the trajectory of my studies and clinical work really over the course of 7 or 8 years. I began to see that this identification and the way that people relate to themselves and relate to the problem and where they localize sort of locus of control around the problem was really potentially very important, and that it might be more helpful to focus on fostering a curious exploration of that relationship and notice how it could change over time, as we know that substance use patterns often do in naturalistic settings, like if people are just kind of left to their own devices or go through the natural course of life. In early 2014, I was just finishing my doctoral studies. I was pending dissertation defense a few weeks away, and I responded to a request for a therapist to train for a role on a study of psilocybin-assisted treatment for alcohol use disorder. And when I spoke with the study team, it was clear that there was a lot of overlap between how I wanted to work with people and the therapeutic model that was being explored in the study. And in general, the idea of using psilocybin in this way just had a lot of synergy with the way that I had taken to approaching and understanding this type of struggle. So I got involved because I really felt that I was aligned with the treatment approach. And that's something that has really continued to be true over the years.
What would you say to a person who may feel that taking a psychedelic substance when they are trying to get sober seems counterintuitive?
So the conflation of the use of a medicine in treatment and under the care of a treatment team with problematic substance use is really an extremely harmful phenomena. This reflects a sort of extremism that stigmatizes the very treatments that can help people who are struggling with substance use and mental health problems. And it results in overly restrictive policies regarding access to treatment. It results in social and legal harms, and it results in a host of hindrances to treatment and to healing, such as shame and stigma. And it's actually based in the idea that people who suffer in this way are, as I said before, qualitatively and permanently different from some semi-fictitious normal that we may construct in comparison to that, in terms of how we would get that basis of thinking that someone is qualitatively different or in a different category. And the truth is that there are a variety of drugs that are approved for and are useful in the treatment of substance use problems. And people are dying without access to them because of policies that are erroneously based in this kind of conflation. And I really hope that this problem doesn't extend to the use of psychedelic-assisted treatments for substance use problems if they are deemed safe and effective and approved by the FDA and available to our public. And right now that's an if, because that's not the case currently. They're being researched, but it may be the case in the future. And if it is, I think it's really going to take a lot of education, both of the public and of healthcare providers, to ensure that happens and that those treatments are accessible and not subject to this conflation and these erroneous stigmatizing ideas. And that's one of the areas that I'm actually most passionate about taking a leadership role in and figuring out how to overcome that barrier.
Before treatment with psilocybin, do patients have to be screened or undergo a medical exam?
Yes, absolutely. So the work that I have done with this indication was in a research setting on an FDA-approved phase 2 clinical trial. And all of the study procedures were heavily reviewed to ensure patient safety, including medical, psychiatric assessment, ongoing monitoring, and follow-up. It's really important to realize also that in this kind of treatment, as it's been studied and in the way that I've worked with it in research, patients are also taking psilocybin in the context of ongoing psychotherapy in a clinical setting and in the presence of a psychotherapy team of co-therapists. So they're not taking this alone. They're not taking it home, and they're really taking it under this very complete container of psychotherapeutic support.
What is the mechanism of change in the brain and body for someone being treated with psilocybin for substance use disorder?
So the short answer is that we don't know specifically. And I think that there are several ways, potential ways, that psilocybin-assisted treatment could be helpful for someone with substance use problems. there may be several at play in each individual's treatment, making it really a multifaceted and holistic approach rather than something we can attribute to one single mechanism of action. In more traditional psychopharmacology research or more biomedically based research, researchers are often looking for one specific biological mechanism of action. But I just don't think that psychedelic assisted therapies, with their rich interactive effects of psychological factors and subjective effects of psychedelics, as well as the biochemical effects of psychedelics, are going to be whittled down to one mechanism of action in that way. Psilocybin is what's known as a serotonergic hallucinogen, and drugs in this general category can actually have anti-addictive properties. Psychologically, it could also result in improvements in mood, self-efficacy, and motivation. And we know that from other research studies that psilocybin reliably occasions what's known as a mystical experience, which is a set of experiences that can be measured together that often co-occur as a result of taking psilocybin, especially in a research setting. And these are measurable effects, and they're reliably produced when psilocybin is taken in a research context. And taken together, I think that these things could catalyze a new way of relating to oneself and the problematic substance use that someone was engaging in. But again, it's not really the kind of thing where I think we're going to pinpoint one specific mechanism of action that works for everyone the way that we could with a lot of more specific medical interventions that take that biomedical approach. But I think we need to think of this in a holistic way and look at a family or an array of mechanisms of action. And we may never know precisely which ones are in play for each individual patient at a given time.
Dr. Nielson, you mentioned that psilocybin may have some anti-addictive properties. Can you explain that a little bit more?
So I think that's a great thing that has not really fully been explored in research yet. I'll tell you where that comes from and explain it a little bit. So psilocybin is one of a group of, as I said, serotonergic hallucinogens or classic hallucinogens. And there are a couple of compounds in that family that are similar and that we tend to see similar biochemical effects as well as similar subjective effects and think, have like overlapping properties as far as they work. And a couple of compounds in that category are psilocybin, LSD, and DMT. There is a long history of the use of LSD in treatment of alcohol problems in research and clinical settings throughout the 1950s and 60s, and even actually into the early 70s prior to the cessation of research for a period of time. And actually, our current research draws on that history for its initial inception and justification, right? Even though we're using a different compound, it's based in the historical use of that very closely related compound. So we know that that is one place which we're drawing some evidence to say most likely compounds in this category have an impact on addiction in terms of making it less probable, right? Less addiction when people are taking these compounds. So that's kind of one piece of the puzzle. And then another piece is that there has been observational research done with people who are part of religious groups that use a tea called ayahuasca, which your listeners may have heard of in some of your other podcasts. I haven't mentioned it here, but it contains DMT and it's used in ceremonial contexts, often by people who are using it on a regular basis. So they might be having it once or twice a month in these ceremonial contexts. So it's a sort of a regular, ongoing, not daily, but on a regular basis use of it. There's been some anthropological research and some observational research that's demonstrated exceptionally low use of alcohol use and substance use problems among people who are using this on a regular basis. Again, it's part of a ceremonial context, not as treatment, but it speaks to the fact that there might be some relationship there.
When a person has a substance use disorder, they may have experienced changes in the brain and body over time that make it difficult for them to recover. How does psilocybin-assisted psychotherapy heal their brain and their body?
So again, we don't really know enough about this yet to definitively say how it works. Early studies, such as phase 2 studies, are really more geared towards demonstrating if something can reliably produce positive change in a target diagnosis. And then later studies can get into the details of how that might work. What we can say is that psilocybin-assisted therapies for any diagnosis, they don't rely on keeping the psilocybin in the person's system or giving them psilocybin on a regular basis to have their effects, like you would see with most psychotropic treatment regimes. But instead, they catalyze a change process that's evident and ongoing long after the psilocybin is no longer detectable in the person's system. And this represents a paradigm shift for how we understand the effects of treatments like this. With most psychotropic medications that a person is given, they need to be continued on that medication for a period of time or perhaps indefinitely in order to continue to reap the benefits of that, having that medication. But psilocybin-assisted therapy can work very differently, and it could be thought of more along the lines of a psychotherapy where you have an experience, you put some changes into place, and then you build those into a new way of living that becomes self-perpetuating.
Do you advise against the recreational use of psychedelics?
So let's pause for a moment on the word recreational. Many healthcare providers and the public often engage in dichotomous thinking about drugs, right? They're either used as an approved medical intervention, and that's seen as okay, or they're used outside of an approved setting, and that's seen as not okay, which we might also expand on and say as, dangerous, hedonistic, or irresponsible. And the word recreational is usually used to refer to the latter category. It has a lot of negative connotations, and I think that there are a lot of people using psychedelics on their own or with peer groups or maybe as part of a ceremonial setting or maybe as part of a religious practice. And they may be using them to work on their own spiritual practice or often to help with their own mental suffering. These are things that people have been known and report to seek out on their own in order to reduce their own mental suffering, to self-treat health problems such as cluster headaches, to participate in spiritual practices, to enhance creativity, sometimes to mend relationships. These are just things that people report using psychedelics for, motivations. And there's a really rich variety of motivations. And I think that gets overlooked when we lump them all together into the idea of recreational use. It can kind of be a catch-all category that doesn't really capture that richness. So when I'm working with people who are considering using psychedelics outside of a medical setting, I take a harm reduction approach, an integrative harm reduction approach, and I want to first understand that person's motivations, unique risks and needs, and then help them to arrive at a decision that's truly right for them without imposing my own judgment about their decision. Risks are unique to individuals. They're unique to what a person's situation is, what kind of safety is accessible to them, and what kind of parameters that their life is in at that point. So I want to really individualize that conversation.
That makes a lot of sense. In your role as the lead trainer for your organization, Fluence, can you explain why therapists need to have specialized training in working with psychedelic treatment? And I wonder if even more specialized training is needed depending upon what psychedelic is administered and what specific mental health disorder is being treated.
Sure. So if we shift gears a little and talk about Fluence, your listeners might be familiar with it from the episode with my co-founder, Dr. Amar Gorman, a few weeks ago. Fluence is an independent training institute for prescribing clinicians, therapists, and wellness practitioners who want training in the field of psychedelic therapy. Because psychedelic therapy marks a shift from traditional pharmacological interventions with results based in the biomedical model and from psychotherapy alone, working in this area really requires some training and retooling of skills. And right now we're training people in psychedelic integration therapy, which therapists can use in their existing scope of practice with patients who are considering using or have used psychedelics in other contexts, the kinds of cases that I mentioned earlier. And we're working towards offering training in psychedelic-assisted therapy with psilocybin and MDMA if and when there's a legal avenue to provide these therapies. So to speak to your question, there are some general principles that I think will overlap between different medicines and indications. But there will also be unique needs for different patient populations, diagnostic categories, and types of psychedelics. And from a training perspective, I think the future will bring a flexible curriculum covering the basics, as well as specialized modules with details and unique skills for a variety of specific drug indication combinations.
What are some of the barriers that prevent the use of psychedelics as a treatment option for people with mental illness, and what can we do to overcome them?
So right now there are several psychedelic-assisted therapies in the drug development pipeline, and that means that they're in research trials and they may be approved for specific indications by the FDA in the next few years. And one thing that's really pressing is that research trials of psychedelics need to include more diverse patient populations. We've seen review studies published that show that across multiple studies, the participant pool doesn't always match the diversity of our population. That can be a problem for generalizing results without perpetuating disparities in healthcare due to those results not being applicable for people who weren't represented in the research studies. So right now, I think a key thing for research to address is ensuring that participant populations are diverse and representative of the population at large.
And to that, you have a diversity fund for therapists, is that correct?
We do, actually. Fluence and our training programs, we have a diversity fund, and we use the diversity fund to assist therapists whose presence in our programs will help make these therapies and clinicians trained in these therapies more accessible to a more diverse pool of people. So we recognize that there are a lot of barriers to participating, and while we might not be able to immediately dismantle all of them, one often common one is a financial barrier. So we do what we can, and we actually include scholarship-funded spaces in all of our trainings so that there's at least some chance for people whose presence would enhance diversity in the field and who would not otherwise be able to attend our trainings to be able to be there.
That's really excellent. The negative impact of substance use disorder on individuals, families, and the larger society are enormous. You and your fellow researchers in the field of psychedelic-assisted psychotherapy are working hard to bring this innovative treatment for substance use disorder to the public. What is the cost of not bringing this treatment to the public?
So the status quo of substance use treatment is, in my experience as a clinician in the field, really one of the saddest failures of modern medicine. Dissemination of evidence-based practices in substance use treatment is a particularly tough problem. If I think back to my dissertation research, this is actually what I wrote about, why some substance use treatment providers are more willing to use evidence-based treatments and others less so. And stigma and personal identity play a big role. We really have a lot of work to do in helping frontline providers understand the potential role of psychedelics in this process. If these treatments are approved for the use in the treatment of substance use problems and can be brought to the public legally and safely, the cost of not doing so will be the continuation of the status quo and the ongoing needless suffering, despair, and death that we presently see.
Can you share a poignant example of where psychedelics had a major impact in someone's life, particularly with substance use disorder?
Yeah, so there are really a number of amazing accounts of people's experiences that have been published. Some are coming from study participants and some are coming from people who've done qualitative research in this field. I think your listeners might enjoy reading some of those firsthand accounts, and they can really see how those experiences have not just impacted the treatment diagnosis that people are coming in for, but really reverberated through their entire lives and created whole new ways of living. So I recommend the book Acid Test by Tom Schroeder. He weaves together the stories of three men, Rick Doblin, Michael Mithofer, and Nick Blackstone, who I know that Ingmar Gorman mentioned on the episode that he did. Another really interesting account is captured in the book Listening to Ayahuasca by Rachel Harris. Dr. Harris is a psychologist and ayahuasca researcher with her own experiences that inform her work. I can't give you too much of a preview of this, but I expect to be publishing in the next year and change, let's say. I expect to be publishing my own qualitative interview study that is based on interviews of people who participated in the psilocybin-assisted treatment for alcohol use disorder study that I worked on. So I'm really looking forward to that because it will be another place where the voices of participants are heard and people's actual stories and firsthand accounts can come through, and readers will get a sense of what that was like for people who came through that treatment.
I'm really looking forward to reading that. Very exciting. Thank you so much for the work that you're doing.
Yeah.
And to hear someone with lived experience, that's really rich. Thank you.
Yeah, I think that the potential for qualitative research in this field is really important. There have been some excellent qualitative studies published, but it's important in research in general that we are listening to our study participants and that we're taking their lived experiences into account. The way that clinical research is generally designed, people come up with a bunch of things that they want to measure and they come up with some predefined categories and then they check and see if the outcomes match those categories. So it's sort of a top-down approach, and qualitative research gives us the opportunity to take a more bottom-up approach, a more organic approach, ask open-ended questions. And so I think that's a really important aspect of doing research in this field.
Dr. Nielson, is there anything that I haven't asked you that you'd be interested in talking about?
Well, actually, today we had some really great news, which is that a paper that I've been working on in collaboration with Ingmar Gorman and a couple of other authors from the field was published, and it's called Psychedelic Harm Reduction and Integration. The paper defines our trans-theoretical and trans-diagnostic model for working with people who either have used psychedelics or are considering using psychedelics in clinical practice. So distinct from psychedelic-assisted therapy, this model gives clinicians a way of having non-judgmental, compassionate, and understanding conversations with people in their private psychotherapy settings where they can help with decision-making, they can reduce stigma, and they can help people prepare for and also to integrate experiences that they've had with psychedelics into the psychotherapy conversation. One of the things that we've seen is that clinicians didn't really have a way of having these conversations that was really theoretically grounded and that wasn't based in the assumption that psychedelic use outside of a clinical practice or a clinical treatment setting was anything except potential evidence of an addiction problem or one of those sort of not good recreational scenarios that we described earlier, right? So we wanted to give clinicians a clear theoretical model for being able to work with that kind of situation in practice. And that's really what the paper is doing.
And as a clinician, I'm very excited about that because we have our biases, or we have to examine our biases, and we don't want to stigmatize our clients inadvertently.
Right. I mean, as clinicians, we're really in a place where I think we have a lot of power in that relationship, and we want to be aware of that power dynamic. And we really need to be aware of how we might be judgmental of people or, maybe attempting to influence their decisions towards what we think is right for them. But this model is really based partly in the integrative harm reduction psychotherapy approach, which values honoring people's autonomy and respecting people's individual decision-making process and being a place where people can have conversations that facilitate them making a decision that they're comfortable with, and then supporting them in doing what they find to be really best for themselves. That is a shift for some clinicians. We really feel that it's an important thing to bring into the conversation about psychedelics because these experiences are not that rare. People are exploring the psychedelics on their own, and we want to give clinicians a model for working with that kind of content in practice.
Yes, and as a social worker, we believe in self-determination, and that's very in line with our belief and our ethics. So what are you most excited about in mental health treatment today?
I'm excited about psychedelics because I see them as an opportunity to challenge the status quo of treatment and make some big improvements. And as you remember from the beginning when I started talking about that being really what I set out to do and had the initial intention of doing. I think that's why psychedelics are so interesting for me. Because of the way these treatments are conducted, they really require new solutions, they require paradigm shifts, and they require creative collaborations across disciplines. So in doing so, I think there's a lot of room to address healthcare disparities and the places that our system is falling short. And that's really why I like studying and teaching about them. I like that they are so interesting and they have so much potential and they're promising. People come in to learn about them and they're excited about it and they're open to these new possibilities. But it gives us a chance to have conversations about larger systemic change that I think are really needed at this point.
If you had a magic wand and could improve one thing about the mental health system today, what would it be?
I'd like to see more research into applications of psychedelic-assisted therapies for substance use problems and how to counteract the policies and social factors that may inhibit dissemination if these therapies were approved. These problems carry a heavy stigma, and people who suffer with them are often shunned, excluded, and disenfranchised. And we know that these problems more heavily impact marginalized communities, those who've been disproportionately harmed by the drug war, and those who may already be vulnerable due to other mental health problems or disability. And I think that this will require a lot of investment in training and educating providers and the public about the potential here, as well as repairing trust by listening to and building bridges to communities that have been excluded from treatment or harmed by research or treatment providers.
So, Dr. Nielson, how can my audience learn more about your work, either online or in print?
So anybody who's interested in my work should visit fluencetraining.com. That is the Fluence website. And there you can find courses to sign up for and a lot of links and materials about our program. There's a page of publications and one of media and videos and articles. And of course, there's a place to sign up for our mailing list. We're also on Instagram, Twitter, LinkedIn, and Facebook. And the icons on our website will take you to those pages.
And all of that will be in the show notes. So, Dr. Nielson, on behalf of myself, my listeners, and all of the people that you've helped through your work, I want to thank you for your contributions to mental health treatment and for taking the time out of your busy schedule to help me and my audience to better understand the use of psilocybin for the treatment of substance use disorder.
Thank you. It's really been a pleasure speaking with you.
Be sure to check out my website, therapyshow.com, which has many resources about mental health. There you will also find how to submit questions, stories, or insights that you have about the mental health system, or suggestions about who else I can interview and how I can improve the show. I'd like to close by reminding our listeners to please subscribe, share, and review this podcast so you, someone you love, and people around the world can gain more benefit from therapy. There is no need to suffer in silence. Get the help that you need to create the life that you want.